So, good morning po, ma'am. My name is Katrina and I am your student nurse for today. So, today po is I'm going to assess your peripheral vascular system. Meaning po is I'm going to check your veins and your pulses. So, before I start po, can you identify yourself po? Can you state your name po?
Joshua Elliot.
So, Jahashal, when is your birthday po?
May 30, 2004.
How would you like to be addressed po?
Jaha.
Okay. So now po is I'm going to provide you some privacy and I'm going to set the temperature to your lighting so that you will be comfortable to your lighting. So now po is I'm going to um, do a proper hand washing to minimize the transfer of microorganisms.
Before starting the procedure, we need to assemble the equipment needed first. Next is wash our hands to minimize the transfer of microorganism. And next is preparing the client. For preparing the client, ask the client to put on an examination gown and sit upright on an examination table. Make sure that the room is comfortable temperature without drops. This helps to prevent vasodilation or vasoconstriction. Before you begin the assessment, inform the client that it will be necessary to inspect and palpate all four extremities and that the groin will be also be needed to be exposed and for palpation and indual lymph nodes, as well as palpation and auscultation of the femoral arteries. Explain that the client can sit for the examination of the arms but will need to lie down for examination of the legs, groin, and will need to follow your direction or our direction for several special assessment techniques towards the end of the examination. As you perform the examination, explain that in detail what you are doing and answer any question that the client may have. This helps to ease any client's anxiety. For the upper extremities, observe arm size and venous pattern and also look for edema. If there is an observable difference, measure bilaterally the circumference of the arms at the same location with each remeasurement and record findings in centimeters. Observe the coloration of the hands and arms. Palpate the client's finger, hands, and arms. Note the temperature. Palpate to assess capillary refill time. Compress the nail bed until it blanches, release the pressure, and calculate the time it takes for color to return. This test indicates peripheral perfusion and reflex cardiac output. After assessing the capillary refill time we need to palpate the radial pulse. Gently press the radial artery against the radius, note the elasticity and strength. We're going to palpate the ulnar pulses, apply pressure with the first three fingers to have the medial aspects of the inner wrist. The ulnar pulses are not routinely assessed because they are located deeper than the radial pulses and are difficult to detect. After that we need to palpate the epitrochial lymph nodes. Take the client's left hands in your right hand as if you are shaking hands. Flex the client's elbow about 90 degrees. Use your left hand to palpate beyond the elbow in the groove between the biceps and triceps muscles. If nodes are detected, evaluate for size, tenderness, and consistency. Repeat palpation on the opposite arm. After that we need to perform the Allen test. The Allen test evaluates patency of the radial or ulnar arteries. It is implemented when patency is questionable or before such procedure such as radial artery puncture. The test begins by assessing ulnar patency. Have the client rest the hand palm side up on the examination table and make a fist. Then use your thumbs to occlude the radial and ulnar arteries. Continue pressure to keep both arteries occluded and have the client release the fist. Note that the palm remains pale. Release the pressure on the ulnar arteries. Watch for color to return to the hand. Assess radial patency. Repeat the procedure as before, but at the last step, release the pressure on the radial artery. Let us now proceed to the lower extremities. For this part we need to ask the client to lie in a supine position. Then drape the groin area and place a pillow under the client's head for comfort. Observe the skin color while inspecting both legs from the toes to the groin. Inspect for hair distribution and lesion or ulcer. Inspect for edema. Next we need to inspect for edema. Inspect the legs for unilateral and bilateral edema. Note for veins, tendons, and bony prominences. If the legs appear asymmetric, use centimeter tape to measure in 4 different areas. Circumference at mid-thigh, the largest circumference at the calf, and the smallest circumference above the ankle. Compare both extremities at the same location. Now we need to palpate edema. If edema is noted during inspection, palpate the area to determine if it is pitting or non-pitting. Press the edematous area with the tips of your fingers. Hold for few seconds, then release. If the depression does not rapidly refill, the skin remains intended or unreleased, pitting edema is present. bilaterally for the temperature of the feet and legs. Use the backs of our fingers to compare your findings in the same areas bilaterally. Note location of any changes in temperature. Palpate the superficial inguinal lymph nodes. To palpate the femoral pulses, ask the client to bend the knee and move it out to the side. Press deeply and slowly below the medial to the inguinal ligament. Use two hands if necessary. Release pressure until you feel the pulses. Repeat to the other legs. Auscultate the femoral pulses. If the arterial oscillation is suspected in the femoral pulses, position the stethoscope over the femoral artery and listen for the breaths. Listen to the other artery. Palpate for the popliteal. Now we are going to palpate the popliteal pulses. Ask the client to raise or flex the knee partially. Place your thumbs on the knee while positioning your fingers deep in the bend of the knee. Apply pressure to locate the pulses. It is usually detected lateral to the medial tendon. Now we are going to palpate for the dorsalis pedis pulses. Dorsiflex the client's foot and apply light pressure lateral along to the sides of the exterior tendon of the big toe. The pulses of both feet may be assessed at the same time to aid in making comparison. Assess amplitude bilaterally. Next we need to palpate the posterior tibial pulses. Palpate behind and just below the medial malleus. Palpating both posterior tibial pulses at the same time aids in making comparison. Assess amplitude bilaterally. While assessing the lower extremities, we need to inspect varicosities and thrombophlebitis. Ask the clients to stand because varicose veins may not be visible when the client is in supine position and not as pronounced